Hello, everyone, and welcome to the Down Syndrome Center podcast. We are so excited to have another podcast today, and today's topic is so important, one that we see quite a bit of in our clinic, and I'm pretty sure for those who are listening, your children or your loved ones with Down syndrome perhaps may have been diagnosed with this, or you've suspected this, and what we're going to be talking about today is sensory processing difficulties or sensory integration disorder. There's so many ways that I've heard it said. And today we have for a really special guest on the podcast with us today, Katie Frank, who is an occupational therapist who works with people with Down syndrome. Well, before I get too much into your own intro, Katie, why don't you tell us a little bit about yourself, who you are, what you do, why you love working with people with Down syndrome, those kinds of things.
Wonderful. Thanks, Kishore. So like Kishore mentioned, I'm Katie Frank. I am an occupational therapist at the Advocate Medical Group Adult Down Syndrome Center in Park Ridge, Illinois. I work with Dr. Chacoin. I have been an OT for 20 years, which is kind of hard to imagine, and I have specialized in Down syndrome since 2006. My love for Down syndrome came from the birth of my little sister. So my younger sister is 5 years younger than me, and she was born with Down syndrome, but unfortunately passed away right before her third birthday. But those 3 years were pretty instrumental in my passion for Down syndrome. And so that's why I do what I do. Her name was Tori. So every day I strive to help Tori and individuals like her.
That's awesome. Thank you so much, Katie, for sharing that. And yet another sibling that we're having on the podcast. There's something about us siblings. We are an odd group, I think we can say, but one that are passionate about working with our families. So thank you so much again for joining us. And I guess what would be really helpful for me and for our audience is really just getting to the basics. What is sensory processing, and what are some of the issues that you've seen with this?
Absolutely. So, Kishore, I'm actually going to ask you a question first.
Oh,
How many senses do you think we have?
oh man, I'm sure I'm going to be wrong. I'm going to go with 5, unless we're watching the movie The Sixth Sense, in which case I would say seeing dead people would be the Sixth Sense.
Well, most people are very familiar with 5 of our senses. So those are touch, sight, sound, taste, and smell. But we actually do have 3 additional senses that are not as well known. So one is vestibular. So our vestibular system helps us move our body through space. It's also has to do with our balance. Then there's proprioception. And so that is a system that helps us know where our body is in space. And it kind of also helps us figure out how much pressure we need to exert, or the force we need in order to interact with things in the environment. And we receive proprioceptive input through our muscles and joints. And then there's the interoceptive system. And this one's kind of a newer system to some people, and it's really related to the physiological conditions of the body, things like feeling thirsty or hungry or knowing when to use the restroom. So it's important to know about those 8 different senses to help us understand sensory processing a little bit. And it's also important to know that, not everyone has a perfectly functioning sensory system, and we all have sensory preferences and even sensory needs, each unique to how our central nervous system processes the sensory information. So for me, I can't eat oranges. An orange in my mouth is like fireworks going off, and I just can't do it. So I cannot chew the orange. I love the smell of oranges. I'll drink orange juice if there's no pulp, but for some reason, the texture of an orange in my mouth just makes me want to, explode. So all of us have differences like that. And for me, it's oranges. So I can avoid an orange. And I'm not going to have some behavioral outburst if someone makes me eat an orange. But for our loved ones with Down syndrome, especially if they can't vocalize what their body's going through, they may feel like fireworks are going off on their body with certain senses. And so we have to be aware of that. And I like to explain to families that our sensory system is sort of like electrical wiring. And so when there's a kink in a wire, the lights may flicker in the room, and that can really drive us crazy. Well, obviously, we don't get a true kink in our central nervous system, but if there was something that was a metaphorical kink in our central nervous system, our messages aren't being able to send properly from the brain to where they need to go in the rest of the body. And so that can happen with our sensory system. And then we start having these mixed messages. And so it makes us interpret how our body is feeling differently than how it really is when there's that kink. So when we, do incorporate sensory into therapy sessions and things like that, we're kind of helping make sure there's not a kink so that the messages can be sent properly from the brain to wherever they need to go in the body.
Wow, that's really, I like that analogy. It's really helpful to think about it that way. What is there something specific like that you're aware of or that you've seen in people with Down syndrome that makes them more likely to have sensory issues, or is it just that we're more cognizant of looking for it? I'm not sure.
I think it could be both, but like I said, so all of us have different sensory needs. And for many of us, if something's bothering us, we can avoid it or tell someone we don't like it. And so someone with Down syndrome may not be able to do that. But I also think that individuals with Down syndrome are often under a microscope. And so we're constantly observing them and seeing what they're doing and trying to interpret why they're doing what they're doing.
Mm-hmm.
I mean, there are plenty of individuals with Down syndrome that do not have sensory needs that really impact their function.
What are some of the sensory processing? What are some signs that a family might see? What are some things that the child or adult with Down syndrome might do?
Well, I think it depends. So one of the lectures I give a lot is it sensory or is it behavior?
Yeah.
Because oftentimes we see them act out in a certain way and it's assumed that it's a behavior, but it really could be a sensory need that is causing that reaction. And so it can be really hard to tell. And that's kind of what we talk about in the presentation. One thing is if this behavior is happening with only one person or in one environment, then that's probably a behavior. But if it's happening in all environments, or it can happen no matter who's around, then it's probably a sensory reason for why that person's acting the way they are. The other thing is if they start acting out and they're given some kind of reward or something that they want, and then all of a sudden the tantrum stops, that's a behavior. But no reward or preferred activity, even time, watching YouTube on their tablet is going to be enough if it's actually a sensory reason or cause for that behavior. Mm-hmm. So those are some things to think about as different. But it's also really important to understand that sensory processing challenges can really affect how a person moves and learns, how they behave, how they complete tasks at home or at school or at work, and even how they interact with others. And so that's when, like I said before, all of us have these sensory challenges, but it's really once it impacts our function or our ability to be, social and engaged in others in the community, that it's really a problem.
Mm-hmm. And so if we're seeing it in multiple environments, it doesn't seem like it's being rewarded, directly or indirectly by how people respond to it. I'm thinking about kids who we follow where, like you were mentioning earlier with the orange or, whatever type of food or texture that they may just consistently just not tolerate. They may not want that in their mouth or on their face or on their lips. They may not want to touch certain feeling, like soft things or squishy things or mixed textures and things like that. Are those all things that people should be saying, okay, that could fit with a sensory processing issue?
Yes.
Yeah. And so when we're thinking about that in people with Down syndrome and we're thinking about how to approach it, what is the right approach to go when we're trying to maybe help them through this? Is there an answer to help them get better?
I mean, there can be. I mean, therapy obviously can help, but I also think it depends on really trying to figure out what the cause is behind it and how much is it really impacting things. So again, for me with the orange, is it really that big of a deal that I can't eat an orange? No. So then we just don't ever give me an orange and life is fine and you won't ever see me, act out. So it's really looking at each person as an individual, right? And but it is interesting because there are some common sensory processing challenges we do see in Down syndrome. And one really does have to do with eating. And so, many individuals with Down syndrome are picky eaters. Mm-hmm. But there's also a difference between picky eaters and selective eaters. So my orange makes me a selective eater. I mean, there's other foods I don't eat either, but picky eaters really, they avoid like a whole food group or a whole certain type of texture of food. And then we know individuals with Down syndrome, so foods that are really chewy require a lot of effort. And just because of low muscle tone and, endurance in the mouth and the strength, they don't want to eat really chewy foods because it's just hard. So we see that, a lot of individuals might not chew foods very thoroughly. They just chew a couple times and swallow. And it's not because they don't know how to chew. It's just because it takes a lot of work. But also, other picky eaters are going to just eat beige foods, right? It doesn't matter what the food is as long as it's beige. Or they only will eat mac and cheese if it's a certain brand, or the chicken nugget has to be from McDonald's and they won't eat a chicken nugget from anywhere else. So those are picky eaters, and that's something that really would require therapy to work through. The other thing we see sometimes with individuals with Down syndrome is that they stuff too much food in their mouth. And that's also a sensory issue, in my opinion. But I also like to tell people that, kind of like the game 6 Degrees of Kevin Bacon, I can kind of do the 6 degrees of sensory processing, and I can bring almost anything back to sensory processing pretty quickly. But with proprioceptive input, again, that's input into our muscles and joints. And so if they're stuffing food into their mouth, it's because they may not even feel that there's food in their mouth until their cheeks are full like a chipmunk's. So if there's just a small bite in there, they can't process that there's any food in there. So they need more and more until they feel it. And then they start chewing. And then obviously it's a problem because many times they might choke if there's too much food in their mouth. So, that's a sensory issue, and often, not a safe eating habit either. And then, I mentioned the interoceptive system before. So this is kind of the newer thing that we're really trying to figure out how to work with it. But we often hear that individuals with Down syndrome don't know if they're thirsty or if they're full or if they're hungry, or even when they have to use the restroom. And that's a sensory issue, so that they just don't have the body awareness sometimes to know and to communicate those needs. And so that's something that needs to be addressed. And oftentimes with the interoceptive system, they talk about using mindfulness to help. Well, individuals without Down syndrome have trouble with mindfulness. So I'm still working on a way to figure out interoception. But there's, just potty training we know is hard. We know a lot of people are working on it and working on strategies to help with that. But until we can also help them understand the need that their body feel, or, the feeling of their body when they need to use the restroom, so that's another way to address that one. And then with hearing, so this is another one. We often have individuals with Down syndrome love their music really loud, but they don't like loud environments, right? Or they don't like someone else's music really loud. And so that's a sensory thing. And we don't know if it's just because of, that there's the hearing, they have hearing loss, some of them, or they just have wax buildup. And so that just muffles sounds and just makes sounds sound different than the rest of us. But just auditory processing can be hard. So they might hear these sounds that they're not choosing just differently than the music they prefer. Right. And so it's almost like nails on a chalkboard for them if it's not their preferred sound. And then obviously we know that they have slower auditory processing, and, they perform best with visual cues. And so that's just really common with Down syndrome. And so then we use accommodations, right? We use visual supports a lot. And I'm going to talk about that, the difference between the near and far sensory systems and how we treat them differently. Then even with vision, depth perception is a challenge. And so that can make going up and down stairs challenging. It can be walking on uneven surfaces can be hard, or going through doorways, especially as individuals with Down syndrome age, their depth perception changes. And we often see they don't want to walk through doorways, or they take a huge step over the door frame, right? Because they're just processing what they're seeing differently. You had mentioned touch. So so Dr. Chacoin's all about health promotion. So we do a lot of that stuff here, in wearing lotion for dry skin. Well, they don't like how the lotion feels, right? Or they don't like water on their face. So they don't want to wash their face or wash their hair. Just different clothing textures, right? So, they don't want to wear denim, or they don't like, tags in their clothes or seams on their socks or whatever it might be. Again, those are all sensory challenges, and sometimes it requires therapy, and sometimes it's just going to require an accommodation or some kind of modification. But then proprioceptive input is really the sense that I start with and I treat the most, or I try to. And that's because since individuals with Down syndrome have low muscle tone, it really impacts how they interpret the sensory input that comes in through their muscles and joints. And so frequently they require more proprioceptive input than the rest of us in order to just help regulate their bodies. It can also make it so that they might do things too hard or too soft. They might, pet the dog a little too hard, but then they don't want to hold their pencil they barely hold their pencil or crayon when they want to write or color. And so it's really important to try to help regulate the sensory system. I'm going to talk about it as like a teeter-totter. We want the teeter-totter to be even, and we don't want it to fluctuate throughout the day. And that's really hard. Like even for us as adults, we know, oh, I'm getting tired or whatever. I might need caffeine or just to go take a walk, or I just need to stand up away from my computer. But, especially kids that are in the classroom, if they try to get up, they're like, what are you doing? You have to sit back down. You're not, and they don't know that they can always ask for a break because they're being told they can't, they need to sit down. So I don't know. There's a lot, I think, that compounds all of this with sensory.
Well, and I think what you hit on were so many of the things that, we hear about so much in the clinic. But before I did this clinic, I used to think, oh, that's just my brother. I had no idea that this was something that was so common amongst people with Down syndrome. And some of the things that you had mentioned, and I think even some of the other ones that we hear, I'm sure you would agree, like haircuts, nail cutting, all that, any of that type of stuff can be so challenging for so many of our friends with Down syndrome. And even in the crowds at the baseball games, often people with Down syndrome will have headphones on to kind of dampen that sound and increase the sound that they like from the music or whatever is playing. So really interesting phenomena there. Well, I guess there's so many ways, because each one of these things is a different sensory issue. I'm sure you have different techniques for each of them, but maybe some of the high points of how do you approach sensory processing in people with Down syndrome to help them?
Yeah, so typically it's going to be an occupational therapist that is going to be the person that is going to help with the sensory processing needs. And it can be in school or in a private, outpatient kind of therapy setting. And what an OT looks to do is create a sensory diet. And so a sensory diet is kind of like a planned, scheduled activity program, and it's designed to meet that person's specific needs, right? So my sensory diet would look very different than your sensory diet, even if we had the same sensory issues, because what works for one person isn't going to work for the other. So I like to talk about when you're building and implementing a sensory diet, it should look more like choosing from a menu rather than following a recipe. Right. So we don't do this, then this, then this, then this. We might have to say, all right, which one of these are we going to try today? And it really is trial and error, which makes it hard and frustrating and confusing for both the individual, the family, the teachers, whomever. But it's just because what works one day may not work the next. And so I also talk about how we need to have a toolbox. So just like our toolbox has different size flathead and Phillips screwdrivers, we kind of need a toolbox of our sensory needs, or of our sensory, treatment ideas, so that we can try this. Oh, that one's not working today. It's too big. So we need to try this. Oh, that's the just right challenge, right? And that's what's really frustrating, because even when families come into the clinic here and see me and we try certain things and they love it, right? And so then the family goes home and tries it and the individual doesn't love it so much anymore. And it's also probably because it was me and they were trying to please me, but also then they're generalizing like, oh, well, that's what I use with Katie in the clinic. That's not what I use at home.
Yeah.
So therapy treatment can be really hard, but when you do find the things that work, it is just, it's just a wonderful feeling to see the changes in the individual. But it's also important to know that our sensory challenges kind of grow and change with us as we get older. They're not just something that we see in kids. And, oftentimes families will come here and I'll recommend something. And they're like, oh, we used to do that, but we don't do that anymore. And I was like, well, maybe you should try again. And then, they see that it helps. And we especially see it once they're not school age anymore, because in school, they're getting regular sensory input, whether it's between changing classes, recess, gym class, whatever it might be if they're in sports. But then all of a sudden they age out of school and they don't necessarily get those natural activities throughout the day. And so we see a change in their sensory needs at that point as well. But I had mentioned that, the difference between doing activities versus the accommodations. And so, and you had even mentioned with the at the game, right? The baseball
Mm-hmm.
game wearing headphones. And so with those 5 familiar senses, we are going to do things that require modifications to address those. But then those 3 other sensory systems, vestibular, proprioceptive, and interoception, are our near sensory systems. And we need to do activities to regulate those systems. And those systems actually need to be regulated first. So they need to be addressed in order to make our teeter-totter even before we can really address those other 5 senses that we know so much about. And so just like that person you saw at the baseball game who might need to wear headphones because it's too stimulating, that's an accommodation. But that same person may have some deficits in their proprioceptive system. And so we would do heavy work activities to help with that. So again, activities versus modifications or adaptations. And so heavy work activities are any kind of activity that get input into our muscles and joints. So it can be exercise, whether it's lifting weights or riding a bike, dancing, taking a walk, swimming, things like that. But it can also be activities we naturally do throughout the day. So chores are a great way to get natural proprioceptive input, any kind of pushing or pulling activity. So sweeping, vacuuming, wiping down a counter, carrying our laundry, carrying in the groceries, unloading the dishwasher, any of those are natural opportunities for proprioceptive input. And those are easy things to incorporate into the day. Because when we do a sensory diet, like I said, it's regular intervals of sensory input. And so it could be, every 2 hours maybe, but you only have to do an activity for 5 minutes, right? You don't need 30 minutes every 2 hours of sensory input. And oftentimes individuals with Down syndrome start understanding, and they can then communicate when their body is ready and they don't need that sensory activity anymore. But other types of proprioceptive input would be like the weighted vests, weighted blankets, vibration, swinging, even though that's really more with our vestibular system, is often also a great activity that can help with proprioceptive input, especially if they have to pump the swing, because then they're getting input into their muscles and joints. Laying in a hammock, rocking in a rocking chair, any of those things, or like sitting and bouncing on a therapy ball. Even using that same ball as their chair in a classroom setting so that they can naturally get a little bit of input without really disrupting everyone else in the class. Those are all easy ways to just naturally incorporate proprioceptive input for short periods of time throughout the day.
Okay. How does that help? Just help me to connect it. So if you have someone with a texture aversion, or somebody who doesn't like the haircut feeling, how would you necessarily use the same technique of proprioceptive input, or is it sometimes a different part of the menu you would choose from?
Well, it really does depend. So with the haircut, you can use sensory input in general to help prepare someone for an activity or for a transition. So in that case, you might use proprioceptive input to help to make their teeter-totter even, so that they can then tolerate that haircut better. We even suggest, they oftentimes put the apron on someone so that if the hair falls down, it's not getting on their clothes, because sometimes it's just the feeling of the hair falling. We'll make that make it weighted so that they're naturally getting proprioceptive input while the task is happening. You can also use distraction. You can use a bunch of things, but incorporating the sensory diet to help with challenging tasks is one way to use a sensory diet. Then you could also use the sensory diet after the task. Once the tantrum, let's say, has happened, or the behavior has happened, to help them calm back down. Again, we don't want the teeter-totter too high. We need to level it back out again. So then we'll use sensory input to help relax them. And again, it's just going to really depend on the person. But with the other tactile, I think you had said something about, was it the tags in their clothes?
Yeah, food in their mouth, or any of those types of
So
texture.
Again, that's different. So that's going to be truly tactile. And so you're going to provide an accommodation or a modification. So it would be like removing the tag or things like that. Whereas a haircut can be, there's so many things sensory wise that they might not like about the haircut. It could be the sound of the scissors or the clippers. It could be the feeling of the hair. And oftentimes they can't tell us exactly what it is. They just know they don't like it, and they're going to freak out knowing that it's happening. So I use a lot of proprioceptive input just for anxiety here. So again, we're using it to prep them for the activity that causes anxiety, to help them feel a little bit more regulated, because if they're teeter-totters even, they may be able to tolerate more of something they don't like.
Yeah.
But if they're teeter-totters fluctuating, then just the littlest thing is going to set them off.
Yeah. That's awesome. This has been really helpful. I mean, I'm trying to think in terms of, obviously each family, each person is going to have an individual need and perhaps an individual accommodation or sensory need that they can meet through the menu, as you mentioned. Would this be something that every occupational therapist is trained in this during the training, or is this something where a family would need to seek a specialized person?
So in OT school, or at least when I went, we all received some information on sensory input and sensory processing and therapy, but it really, you have to develop it more as a therapist. So many pediatric therapists naturally incorporate sensory into their therapy sessions, even if the person's not seeing them for sensory needs, because we're going to do something to help prep their body in order to tolerate everything else in therapy. When it comes to adult therapists, unfortunately, they tend to work in settings that are not conducive for, adolescents and adults with Down syndrome. And so you're not going to just not go to a rehab center if you're an adult with Down syndrome and get sensory therapy.
Got it.
The other thing that's tricky is that in school, a lot of families think that school-based therapy is sufficient and that they don't ever need to pursue additional therapies. And while, some schools are better than others, unfortunately, the therapists tend to be limited by time and resources and large caseloads, that when it comes to sensory, they are better able to address those far senses. So sight, smell, taste, touch, and sound. I think that was all five.
Yeah.
With those adaptations and those modifications, and they might not be able to really address vestibular, proprioceptive, or interoceptive. And so that's where an outpatient therapist can be beneficial. And even though I'm an OT and I think OT is really important, I would never tell a family they need to have their child in any therapy from the day they were born till the day they die. There's going to be snippets of time where there's a certain skill that you want to be addressed, and that's when it's important to seek therapy. And then once that goal's met, you can move on and you can take a break. And I think that's really normal and healthy. So that's where I would recommend getting private outpatient therapy for sensory needs. And there are therapists that are better suited. They just have more training. And oftentimes if they have little bios on the website, they'll talk about how they, tend to address sensory needs. There's not a special certification you have to have. There is a special certification to do a sensory evaluation called the Sensory Integration and Praxis Test. But that test is only for if your age is 4 to 8 or something. And so while they have more training because they have to administer that test, you do not have to be SIPT, SIPT, certified in order to treat sensory
Got it.
processing.
Okay. And if there was a place or are there places that you would recommend where families can get more information, even just the basics on, what is sensory processing and things like that? Are there places you could recommend for us?
Absolutely. So obviously I have created a bunch of resources here at the Adult Down Syndrome Center. So you can always refer to our resource library, which is adscresources.advocatehealth.com.
Okay.
And then Dr. Chacoin and Dr. McGuire just published the second edition of the Mental Wellness and Down Syndrome book. And there's actually a chapter that I wrote on sensory processing that kind of goes into more detail about all of this that we talked about today. But there's a number of books out there. There's one called The Out of Sync Child. which I find very, nice for families. And then there's also the Out of Sync Child Grows Up. So what it looks like when someone has sensory processing as an adolescent. And those are by Carol Stock Kranowitz.
Okay.
And then there's Sensational Kids by Lucy Jane Miller. And she's kind of like the godmother of sensory as an OT. She kind of, she's a big name. And so Sensational Kids by her is really good. And then there's the Star Institute, and they have a wonderful website that shares a bunch of information about sensory processing.
That's fantastic. I will put all of these in the show notes for our listeners, so they can just click on it and go to any of these resources. That's really great. Well, before we close the podcast, Katie, I really appreciate your time and expertise in sharing today. What would there be anything else you'd want to make sure that we covered that we didn't talk about today?
Well, can I get on a soapbox real fast about
Please.
Weighted blankets?
Yes.
So weighted blankets are not meant to sleep under.
Okay.
Even though that's how they're promoted. And the reason being is, well, it's kind of twofold. One, with our sensory input, when something is, let's say we're putting on a ring or our glasses, right? So you put your glasses on for reading, and then you put them on the top of your head. And then, an hour later, you're like, oh, where are my glasses? Right? Your body tuned it out because it realized your glasses weren't harming you, right? They weren't causing pain or anything like that. Well, sensory input's the same thing. Once our body gets used to the weighted blanket or whatever the sensory input is that we're doing, it's going to tune it out. So we really only need it for short periods of time. So it kind of makes the weighted blanket useless.
Interesting.
But it helps to regulate the body to fall asleep, but it's not something you need to sleep under all night long. And then the other thing with weighted blankets is just to make sure, I recommend 7 to 10% of someone's body weight, no more, but it can always be less. Oftentimes, if you look on a website, it may say 7 to 10% plus X number of pounds or whatever. And so what's really great is that weighted blankets have become so much, more easily available because you can get them at Bed Bath & Beyond and Walmart and all that. And I don't think that that's a problem, but just don't follow their weight recommendations, because their weight recommendations are like 14 to 26% of someone's body weight. And so just make sure that your loved one, if they weigh 100 pounds, you should do, 7 to 10 pound blanket and look for that weight. Don't follow their weight recommendations on the packaging.
And just to make sure I understood correctly, so then you would say after they fall asleep, you would suggest they could even just remove the blanket? Is that okay? Very interesting.
Yeah, absolutely. And I mean, you also want to think about like how many of our loved ones have sleep apnea. Well, now you're actually adding extra weight. And if they're, especially if they're not getting treatment, or if they have heart defects, or if we have a blanket that's too heavy and it makes it too hard for them to get out of by themselves, there's just no reason to risk that.
Super helpful. Thank you for that. Yeah. Well, our families, our listeners, I hope you learned as much as I did. When I do these podcasts, very often I'm asking questions because I don't know the answer. And so this is really helpful for me, and I hope really helpful for you. I want to thank the listener who sent out this request for us to talk about sensory processing issues in Down syndrome. I think you by asking that, you've probably helped so many more people all around the world who have these same types of questions. So thank you. And I really encourage any of our listeners, send us a question at downsyndromecenter@chp.edu. We do hear you. I do respond very quickly, and we love to be able to address any questions that you have. But until next time, bye-bye.